Thank you, Senator Gordon. Will you remark further? Senator Sampson.
Good evening, Madam President. Thank you for the recognition. I've been listening to the discussion on this bill, which is Senate Bill 7, clearly one of the majority's priority bills, entitled An Act Concerning Protections for Access to Health Care and the Equitable Delivery of Health Care Services in the State. And not serving on the Public Health Committee, this is not a bill that I often have a lot of connection with up until the moment that it actually hits the Senate floor. So I'm reading it today for the very first time, and I understand that the document that we have is relatively new as well. It's combined a bunch of individual bills, and it's been massaged, I guess, is one way to put it, to come up with this final creation, which I believe is 34 pages long and has a number of different sections. And I wouldn't say that much of what I found in here was surprising. I've seen this similar bill, almost every cycle. We have one big public health bill, and this is, pretty much along the lines with the other ones. However, a few things did stand out to me, frankly, when I started digging into this bill. And I just want to talk about those couple of sections, which I decided to stand up and raise a concern over. One of them is the Section 5, which is an entirely new section in our state statutes. It's not changing anything existing. Section 5 apparently creates something called a safe harbor account. And what I'm gathering is this safe harbor account is essentially going to use the Treasurer's office to create a fund, and that fund is going to be used for the purpose of allowing folks to use dollars to receive certain types of medical treatment. And I've got to say I use that term a little loosely, because one of the things that I noticed is looking at that the types of coverage that will be available includes a number of things, but I wanted to point out number 2, which is on line 128 of the bill on page 5. It refers to gender-affirming healthcare services. And I just have a couple of questions about this through you, Madam President, to the proponent of the bill. I'm just questioning what is included under the heading gender-affirming healthcare services. And I'll note that the definition says, it says means all medical care relating to the treatment of gender dysphoria as set forth in the most recent edition of the American Psychiatric Association's DSM manual. So, through you, Madam President, what exactly is included under the definition of gender-affirming healthcare services through you?
Thank you, Senator Anwar.
Thank you, Madam President. Madam President, I wanted to thank for this question from the Senator. There are two components. There's a DSM-5 classification, and then there's an ICD-11. And one of the conditions is a gender dysphoria. This is considered part of the psychological assessment, and which is a situation where an individual who has a gender that is assigned at birth, and they feel that their the assigned gender at birth is something that is causing them to have distress and discomfort, and they would prefer to have a different gender. So that's how it was defined in the DSM-5, and gender incongruence is part of ICD-11, which is again a similar perspective that's from the medical side rather than psychological side. Through you, Madam President.
Thank you, Senator Sampson.
Thank you very much, Madam President. I appreciate the answer, although I'm looking for something more specific. I mean, when I hear gender-affirming care, I think about things like puberty blockers, or the things that we hear about in the news. I hear about gender-affirming surgery, mastectomies, that type of thing. I'm curious if those things are covered. I mean, I certainly understand that this is designed to treat gender dysphoria, but I'm concerned that it might not be what I would consider the appropriate treatment for gender dysphoria, which would be mental health treatment, but it might rather venture into the realm of gender-affirming care, which I understand that to be not a mental health treatment, but more something to actually help people transition or begin to, attempt to change their appearance through you.
Thank you, Senator Anwar.
Thank you, Madam President. I was not able to understand the question. Perhaps if my colleague would be able to rephrase it differently in the form of a question.
Senator Sampson.
Thank you, Madam President. As simply as I can put it, I'm asking what might be included under the definition of gender-affirming healthcare services, whether that is limited to mental health treatment or it actually includes such things as surgeries or medication like puberty blockers that are designed to allow people to attempt to change their appearance in an effort to appear as a different gender. Through you.
Thank you, Senator Anwar.
Thank you, Madam President. Through you, Madam President, yes.
Thank you, Senator Sampson.
Thank you very much, Madam President. I appreciate that. Yeah, this concerns me, and that's kind of why I was wanted to ask about it. Can I just ask? I noticed that this fund, it looks like it is purposely drafted in the bill to appear as an account that is wholly separate from the state government and does not use state funds. However, I'm reading through this, and I'm understanding that it's going to be set up in the Treasurer's office and that he's going to have the ability to manage these funds, that there will be administrative costs associated with that. It does say that those funds will not, or the costs will not be passed on to taxpayers, but I just don't understand how you can have staff and other personnel involved without using some sort of state resources. So I'm hoping that the good gentleman can give me an answer to that question. How are we handling the fact that there's certainly the state treasurer's office and his staff are involved? Through you.
Thank you, Senator Anwar.
Thank you, Madam President. Through you, Madam President, I wanted to thank for this question, and I would bring the attention to line number 190 in the bill, which speaks about the Board of Trustees shall adopt policies and procedures concerning the details of the grant and the various ways of functioning. So that will be not later than September 1st, 2025. Through you, Madam President.
Thank you, Senator Sampson.
Thank you very much, Madam President. I appreciate that answer. I am looking at this Board of Trustees. It appears to me that it says that the board will be including the treasurer or the treasurer's designee, so that's one person, and then it says 4 members appointed by the treasurer, and then it has requirements for those folks. One that has to have experience with working with members of the LGBTQ plus community, one of them that has experience working with providers of reproductive health care services, which, you know, if I wanted to spend a lot of time on this, we could dig into the definition there. And then the next thing is someone who has experience working with providers of health care or mental health services to members of the LGBTQ plus community. So am I correct about this? Through you, Madam President, there's 5 members of this board, and effectively they're all chosen by the treasurer, because the treasurer is one of them, and then he has 4 appointees, and they are all in some way, shape, or form connected with the LGBTQ plus community. Am I correct about that, through you?
Thank you, Senator Anwar.
Thank you, Madam President. Madam President, the part about 5 members is correct. The second part about every person being part of the LGBTQ plus community is inaccurate.
Thank you,
Thank you.
Senator.
Through you, Madam President.
Thank you, Senator Sampson.
Thank you very much, Madam President. Maybe you can clarify for me, is it that there are only 2 or 3 of the members that are associated with the LGBTQ plus community? Through you.
Thank you, Senator Anwar.
Madam President, through you, and I'll read this so that there's less lack of confusion around this topic. 4 members will be appointed by the treasurer. One of them shall be a provider of reproductive health care services in the state. It does not identify what that person identifies themselves as. One of whom shall have experience working with members of the LGBTQ plus community. Again, that does not specify how that person identifies themselves, and one of them shall have experiences working with providers of reproductive health care services. Again, this does not identify what that person identifies as well. So that's 3 individuals that are not required to be of LGBTQ community, and then one of whom shall have experiences working with the providers of healthcare or mental health services to members of the LGBTQ plus community. Again, all 4 members are not part of that community, but have been intimately involved in management of them, either as a clinician or as a part of healthcare system. So, through you, Madam President.
Thank you, Senator Sampson.
Thank you very much, Madam President. I appreciate the clarification. Senator, as I mentioned, I am just looking at this bill for the first time this evening, and I'm trying to wrap my head around it. And certainly, I certainly respect anyone's point of view and their desire to advocate for positions and lifestyles that they choose and so forth. However, I'm here representing my constituents, and I do have a concern about the use of taxpayer funds for certain activities. And one of those activities would be taxpayer funding in the case of abortion procedures. I know that there's some amount of state funds that do end up contributing to that, but for me, I would suggest that people have the right to engage in that as a lawful activity, but I don't believe that taxpayers that don't believe in it should be forced to pay for it. And the other aspect of this would be that I think that folks that disagree that the proper response to someone that has gender dysphoria is some sort of attempt to accommodate the desire to change one person's gender, which I don't believe is actually possible. And as a result, for me personally, and I know I represent a great many people in the state, I don't believe they want to see taxpayer funds go for that either. So I'm certainly respectful of the idea that we're setting up something that is supposed to be outside the realm of state taxpayer funds. And for me, that's a good thing. Except, frankly, I don't buy it 100% because essentially this is in a state statute, and the people involved are the treasurer of the state of Connecticut, using the resources of the state of Connecticut, the staff of the treasurer's office, the administration of the treasurer's office. I mean, are people going to clock out of working for the treasurer's office to clock in to work for this board of trustees to make these decisions and then clock back in a few minutes later? I don't think that's going to happen, frankly. And I just don't like the idea of using state taxpayer resources for these things, while at the same time I would absolutely 100% protect the right of people to engage in whatever behavior they want to lawfully outside of the taxpayer's dime. I just see that that is a line in the sand for me, that you don't use taxpayers' fund to, again, and this is true for anything. I don't think taxpayers' money should be used lightly for any reason, and I certainly don't believe taxpayers' money should be used for purposes that are in direct contradiction to the views, whether they are personally held, religious views, or ideological views of the person that's funding it, which is why many states across the country have set up policy to suggest that while abortion might be legal in their states, the taxpayers' money cannot be used for that purpose. And that's why I'm just drawing attention to this part of the bill. But I'm going to move on and just approach the other section of the bill that raised some concerns with me, and that is Section 23, which is this creation of this overdose prevention centers, I believe that they are called. And the wording in the bill basically says that a person with a substance use disorder can receive substance use disorder and other mental health counseling, and then it says they have the access for laundry machines, a bathroom, a shower, a place to rest, sounds like a nice place, but also a separate location within the facility to safely consume controlled substances. And I was listening to this being discussed by my colleagues around the circle, and I've got to tell you, I find it shocking. In my view, the fact that the state of Connecticut would be using taxpayer dollars once again in the process, in the practice of enabling illegal drug use surprises me. And I think it should shock people that are listening. I don't believe it's appropriate to normalize and enable drug use. If you're trying to stop someone from being addicted to drugs, you should stop them from having access to drugs, in my view. This doesn't prevent drug abuse. This facilitates drug abuse. Would we be considering having people who commit other crimes having a safe zone to reside in? Would we have a secure DUI lounge where if you have a drinking problem, you should be able to come and sit around? You know, should we allow people to commit robbery to come to a safe robbery clinic? No, it's absurd. And so is effectively a drug den, in my view. Do you know, folks, that there is a federal law? It is 21 U.S. Code 856. That is the law that says it's illegal to operate a place for the purpose of using controlled substances. And do you know what that law is called in Washington? It's the Crack House Statute. That's what it's called. It's called the Crack House Statute. And this, right here, we're debating putting the Crack House Statute, something illegal on federal law, into our state laws, right here. Through you, Madam President, are there any limitations on the number or timeliness of the visits for people to this overdose prevention center? Through you.
Thank you, Senator Anwar.
Thank you, Madam President. Through you, Madam President, I just wanted to clarify a few things. It's worthy to look at this. To use a historical law that has been from a law enforcement vision when you have a public health situation is how many of the professors of law are not recognizing it as a law enforcement issue. It's a public health issue. Considering it's a public health issue, that law relevance is not there anymore. This has been actually looked at by academicians across the country. They are recognizing that the law using it as from the crack house law is completely obsolete, and this is not relevant. That was one part I think it's worthy to mention. The second part, I think the Senator's comments give me the opportunity to talk about the challenge we have about the stigma that is created. While we are talking about this as an opioid use disorder, it's an illness. There's a substance that a person is using which is having an impact on their condition. So if we were to use it from a lens of a condition or a disorder, you have an opportunity to be able to address this. And that's where the concept of recovery comes in. And that recovery allows that person to be able to detach themselves from the substances. It's not a linear process. This has been proven. And especially on a recovery day, it's important to use this opportunity to highlight this reality that people who are listening, please understand that stigma that sometimes is created by individuals who may not have the knowledge, understanding, empathy about the issue, they may use words that are harmful. But the reality is that it's a disorder which is treatable, and there is hope for recovery because thousands of people are enjoying recovery at this time. And it's important for us to continue to push for recovery and recognize that you have to live to be able to recover. And recovery, again, is not a linear process, and therefore we need to make sure that the individuals who fall through the cracks have an opportunity to be able to get back on track. And this is not rocket science. We have known this since substances have come into existence, and we have been able to take care of that. Now to try and equate that with some of the other components is just sloppy thinking, for a lack of a better word. I think there's a medical condition and then there's a legal condition. If somebody is committing a crime, there's a way to deal with that. Now there are some other ways to be able to manage that, but this is a substance use disorder which is managed in a different manner. So that's why I think it's worthy to clarify that perspective, Madam President, through you.
Thank you, Senator Sampson.
Thank you very much, Madam President. I appreciate the good chairman having a disagreement with me about the merits of the policy before us. However, I think he should refrain from referring to other people's opinions as sloppy thinking or suggesting that because someone disagrees, they don't have the same empathy for people that are in this situation. Through you, Madam President, you, sir, have no idea what my experience is with people that have drug abuse problems. I've been a lot closer to the subject than you might imagine. I know people, and I also know how to correct the problem, and that is not to enable their behavior. And I'm here standing up for the purpose of trying to protect people from what I think is a terrible policy that will only end up with failure and more people suffering drug abuse and potentially an overdose. I asked a very simple and direct question, and I'd like an answer to the question, not a lecture about how smart I am or how empathetic I am. The question is very simple. Are there any limits in the statute about how long someone can stay at this, overdose prevention center, how often they can visit? Is there a limit at all? Can they stay there for multiple days, weeks? Can they come back over and over again indefinitely? Through you.
Thank you, Senator Anwar.
Thank you, Madam President. I want to apologize for my colleague for hurting his feeling about what I said. I was actually referring to the people who are listening who are using substances. It was meant for them, not to my colleague. To the exact question that's being asked, the bill speaks about this group that is going to be described, which is going to develop the policies. Rather than putting the policies into the legislation, we are working with the process that was used by Rhode Island. And in Rhode Island, what was created was the Demas equivalent agency took the lead with all the experts, and they were able to make the specifics on the policies that would be written down on how to be able to address this issue. Through you, Madam President.
Thank you, Senator Sampson.
Thank you very much, Madam President. I appreciate the fact that this is a new pilot-type program. I heard somewhere that it's going to end up in 4 towns in Connecticut. I don't know if that's accurate or not. But it appears to me that the answer to my question is plain, that it doesn't exist inside the language of the bill, the 4 corners of the proposal that is in front of us, and there seems to be no limitation whatsoever on how these facilities can be used. I'm curious what these facilities are going to look like. Is there any indication of whether this will be a clean hospital-type setting, or is it going to be a more relaxed type environment? Is there any indication on that? Through you, Madam President.
Thank you, Senator Anwar.
Thank you, Madam President. Madam President, in the legislation, it's not described, but this is something that Rhode Island, about an hour and 40 minutes from where we are right now, there's a facility that is being used, and it's like a clinical facility, but a place which is safe and has individuals with clinical background, their ability to manage an emergency situation. It is also monitored, and there's oxygen available if somebody needs it, and also has the ability to make sure that the harm reduction component is available with respect to needles that people can exchange. If they need any other support, there are therapists available, and then they have access for rehabilitation as individuals decide and choose to use it. So that's one of the models that has been very effective. We have a very similar model that is in New York as well. And now these things are not in the legislation because we are asking for individuals with the various backgrounds to make the policies for the state of Connecticut. Thank you. Through you, Madam President.
Thank you, Senator Sampson.
And thank you very much, Madam President. I don't have any more questions for the proponent of the bill. And I'll just wrap up very quickly to suggest that this is, as I mentioned from the outset, a long bill. There's a lot of sections. I know that a lot of hard work went into this from all of the parties in the Public Health Committee and others that have contributed along the way. I want to give them credit for their effort. There's some good parts of this bill, and clearly, from my point of view, there are some questionable parts of this bill. I will just suggest that the 2 sections that I mentioned, this creation of this safe harbor policy, I think is extremely toxic. I think if you want to treat people that have gender dysphoria, you have to treat the first and foremost primary symptom is that they're suffering a mental disorder. And that should be the first and primary thing that you address. You shouldn't be jumping to creating policies that will enable, with very little, frankly, direction. I don't know if there's any malpractice insurance associated with this safe harbor program. I don't know the oversight that will exist. And frankly, I think it opens the door for procedures to exist, the promotion of puberty blocker type medication, and even surgeries on minors. And I don't, like a lot of people in this country, I believe that this trend is something that is shocking, and we're hoping it's a fad, because I don't think that it's natural. I don't think that most people who actually step back and consider it recognize that it's actually possible to change one's gender, and that folks that are caught up in this, in many respects, are hurting, and they need help. What they don't need is someone to try and affirm their mental illness. We've more and more, just in the last year, come in contact with people that have been living this terrible condition and have come out on the other side recognizing that they made horrible mistakes trying to run down this path of attempting to change their gender because of their internal conflict and confusion. And I am just torn up every time I think about several individuals that I've come in contact with that have effectively damaged their entire future because they took medication they shouldn't have, which changed their physiology in a way that is never going to be the same. People that have actually modified their bodies in a way that is going to stick with them for the rest of their lives. Treat the mental illness. That's what needs to happen. Do not create policies that encourage this madness, which I think someday in the future we're going to consider to be criminal. And as far as setting up a state-funded crack house or drug den, which I know I'm using inflammatory language, but I'll tell you what, what's the difference? You're setting up a place where people are going to be encouraged to come and consume illegal drugs. It's crazy. And what shocks me even more is that this is being promoted as if it's medicine. I thought the very first step in medicine was the Hippocratic Oath, do no harm. And I'm telling you, giving drugs to a drug addict is harming them. It's never not harm. Every time. You are prolonging what actually needs to happen, which is the desire to get off the drugs, not encourage them to continue. Safe consumption, that's a dead end. You should be helping addicts get clean. For those reasons, Madam President, I can't support this bill. Thank you.
Thank you, Senator Sampson.
An immediate roll call vote has been ordered in the Senate. We're now voting on the bill as amended by Schedule A and B. This is Senate Bill number 7, an act concerning protections for access to health care and the equitable delivery of health care services in the state. An immediate roll call vote has been ordered in the Senate on Senate Bill number 7 as amended by Schedule A and Senate A and B. An immediate roll call vote in the Senate.
Machine is locked. Mr. Clerk.
Senate Bill number 7 as amended by Senate A and B. Total number voting 35, total voting yea 25, total voting nay 10, absent not voting 1.
Legislation passes. Mr.